appreciate it. And to the Millers, you guys are just so amazing, both of you. But you know, I deeply love this country, and I so deeply love America and Tennessee, and I want to just share with y'all for a few minutes why I've embarked on this journey to run for the U.S. Senate, and then we can talk about whatever you'd like to talk about. But for me, it all begins with my parents, with my mother and father, like it does for so many of you, I imagine. So my parents, they grew up in India in the 1940s. And I don't know if any of y'all have seen that movie, Slumdog Millionaire, before. Have you seen that movie? Well, that level of poverty in that movie is real. It's true. It exists. And when my mother and father were little children, their homes were burned to the ground by Muslim radicals. And they lost every single thing they had. But by the grace of God, they both pulled themselves up by their own bootstraps to become doctors. Now, my mother, she would tell me these stories about going to medical school. And part-time, she would be a nanny. And part-time, she would go to villages in India without electricity or running water to see patients. Now, my father, he would sleep in the back of this beat-up Volkswagen in these 120-degree New Delhi nights, do all these odd jobs, and see patients during the day. So they both got through medical school, and they're looking at their brothers and their sisters, their nieces and their nephews, and they just realize that India is not going to be the place for their unborn kids. But you know, they had talked to people who had made the journey here. They had read about it. They had heard about this promise of something better, a better way of life called the American dream. And they wanted that for their kids. So they did what a lot of people did back then. They went to the U.S. Embassy. They stood in line and waited their turn. And in the 1970s, they came to America legally with an L. Now, you gotta say legally, because listen, so I've never done this before. I've never run for office. So about 16 months ago, something like that, I've been on the road about 18 months. I think I was in Sparta. And I said, yeah, you know, my parents that came to this country, and this guy comes up to me. And he goes, did they come here legally? I said, yes, sir. And then he goes, true story, he goes, you're not an anchor baby, are you? Now, somehow that got away from me. I was like, ooh, that sounds kind of bad. I don't think I am. I don't know. What does that mean? And so they got here in the 1970s. They landed in Cleveland, Ohio, and that's where I was born. They retrained as doctors in the American system. And then our journey really began when at the age of 4, I got on this semi-truck, and I remember it like, I vividly remember it. And we rolled on down to Coffee County, Hillsborough, Tennessee. Now, do y'all know Coffee County? Yeah. That's where I'm from. Mm-hmm. And Hillsborough was a farming town. And people didn't have a lot, but they had each other. And they invested in me and my older brother, and you'd have just never known the hard times that some of these folks faced. Now, my parents, they were the only 2 doctors really in Hillsborough, among the only 2 in the entire county. And my mom, she was an OBGYN, so she delivered babies and babies of the babies. And in fact, there's a greeter at the Manchester Walmart named after my mom, so go figure. And my dad was a primary care doctor, and he was just an incredible doctor. He was kind of a jack of all trades. So he was the heart doctor and the stomach doctor and psychiatrist, occasionally the marriage counselor. Like he did it all. And in our town, we only had 2 ambulances. And so we had this big old blue Delta 88 Oldsmobile. Y'all remember that car, the 88 Oldsmobile? It was just dark blue, and that was kind of like the SETHI ambulance. And we go all along the back roads in Coffee County and Grundy County and Warren County seeing patients. And I very vividly remember this one night. I was 10 years old, and we went to pick up a farmer in Altamont. You know where Altamont is?
Yes.
So we go to Altamont, and we go to pick up a farmer, and this guy's having chest pain, shortness of breath. I mean, he's having a full-on heart attack. I'm 10, I'm in the back of this car, we'll rush to the hospital down Highway 41. My dad's easing this gentleman. We get to the hospital, he runs him inside, and then he comes out. And this is the part that I very vividly remember. My dad was comforting the family, and that's something I've gotten to do as a trauma surgeon. But there was a moment where a family member, and he was standing kind of like where we are, reached into his pocket and tried to hand my dad some money. Not once, not twice, but 3 times. And every time my dad just waved it off. He wouldn't take it. So my dad gets in the car, and I climb up in the front seat with him, and we're riding home, and we were really close. And I just asked him, I said, well, Dad, why didn't you take this guy's money? And what he said next is so important because it's driven my life, it's the course of who I am. He said, you know, son, it doesn't matter what's in your bank account, but what matters is the difference that you make. And I'll say that again, it's so important to who I am. Doesn't matter what's in your bank account, but what truly matters, what ultimately matters, is the difference that you make. And that's how I was raised in this small town, watching them doctor farmers, and then boom, in my early 20s, I lost my father to liver cancer. Now, I don't know if any of y'all have lost your family when you're young, but it does a number on you. It really changes you. And for me, it was the hardest thing I've ever gone through, the hardest thing I've ever faced. It was almost like I couldn't find my balance. And I don't know if you've been through struggles in your life, but that's what it was like. And nobody could help me. I couldn't find my way out. But that's when I came to Christ. That's when I found the Lord, and that's when I was saved. And that's when I realized that like 3 generations of my family before me, that I was going to become a doctor too. So I went off and I did that on that journey, and for the last 10 years, I've been a trauma surgeon down the road at Vanderbilt. Now Vanderbilt is a very crazy place. It's the 3rd busiest level 1 trauma center in America. And doing that job, what you learn is the line between life and death, it is razor thin. Razor thin. And so in the time that you got, the Lord's giving you on this earth, try to make the biggest difference that you can make and help the most people that you can. And I feel like I've been doing that. About 9 years ago, my wife Maya and I, so I met Maya when I was 16. She tried to come today, but our kids, everything's canceled because of this COVID thing. We met when we were 16, my first and only girlfriend, then my wife. Many of you have met her. We created this nonprofit called Healthy Tennessee. Been all across the state, taking care of patients, trying to get them on the front end of their care. Now the president, he heard about this. This is a true story. He invited me to the White House. So I go to the White House to meet the president, and he couldn't remember Manny, so he nicknamed me Tennessee. True story. Spoke at one of his rallies. Look, folks, now more than ever, we got to support the president. Right now, more than ever. And so I felt like I was making a difference there. But now with this open U.S. Senate seat, I very deeply in my heart feel it is a generational opportunity to make a difference. Generational opportunity, but a different kind of difference. Now listen, America is the greatest country in the history of Earth. And don't let anybody ever, anywhere, at any time, tell you different. My family's story, my own personal story, is a testament to that. But we face some challenges. We face some real challenges. And I want to talk to you about a couple of them. The first one is this mob. Is anybody sick of this, of the burning, of the rioting, of the looting? And when you say anything about it, they call you a racist? We have got to take this head on. Head on. And if I'm your next U.S. Senator, I promise you we will.
All right.
The second big issue, and this is something I have just really seen with my own eyes, is just this pandemic that we just went through. Now look, I was on the front lines of this thing. I saw it in ICUs, taking care of trauma patients, this COVID. And what I learned from all of this is that we are entirely too reliant on the communist Chinese government. I'm talking about, our gloves, our gowns, our masks, 20 medications, antibiotics that we don't make here. We cannot make them here. We are reliant on our communist Chinese enemy. And for 30 years, the Washington Republican establishment, the elites, they told us these people are our friends. They are not. They are not. If I'm your next senator, we will have a second industrial revolution in America. We have to bring those supply chains back here. It is a Another big thing we've been talking about for the last 18 months is Obamacare. Now, for the last 10 years, I've been traveling Tennessee, talking about what would happen, how bad this thing would be, and it's worse. And I think it shows you the disaster that happens when government gets between a patient and their doctor, or when government gets in the insurance market. Premiums go up and deductibles go up. But for the longest time, the Washington Republican establishment lied to us. They said, if you give us the House, we will repeal and replace Obamacare. And I ask you, did that happen? No. They then said, wait. If you give us the U.S. Senate, we will repeal and replace Obamacare. And I ask you, did that happen? No. It is the single greatest failed political promise in American history. And they failed us because they don't have a plan. They could not clearly articulate a plan to the American people. And that's something I've got. It's a free market-based plan. And look, this is not rocket science, but I shouldn't say rocket science because I was in Polk County and I said that and a rocket scientist came up to me afterwards. Because I'm actually rocket science. But look, it's three very basic things that we need to do to change healthcare in America. Three very simple things. And they try to make this very complicated, but it's not. The first one is price and transparency. You got to know what you pay for. Look, in healthcare, there are the three P's: the payer, the patient, the provider. None of those three know what we're paying or what we're charging. If you don't have transparency, you cannot have competition. It's very simple. Number one. Number two is what I call an individual insurance market without that large hand of government. So what I believe is we need more insurance options for employees of large companies, for small businesses, for individuals. I personally believe that health insurance should be tax deductible for small businesses and individuals. It's currently not. I believe we should be able to compete across state lines. We currently cannot. I believe we have to get rid of the 10 essential health benefits in Obamacare that are driving costs up. Right now, with your health insurance, a 90-year-old pays for maternal benefits and a 20-year-old pays for nursing home benefits. That makes no sense. That has to change. But finally, here's the thing that the people just won't talk to you about. These politicians, they just won't tell you. And I don't know if you've seen our commercials, but I'm all about straight talk. And that is about prevention. Look, in our country right now, we pay to treat disease. Our healthcare system is entirely based on treating disease. If you have a heart attack, if you have bad diabetes, you become our best friend. But if you're pre-diabetic, if you have heart disease but haven't had a heart attack, nobody cares. So just think about that. Why are we spending $1 million on the back end of something when we could spend cents on the dollar on the front end? That makes absolutely no sense. And so we can change healthcare. And finally, is something that's very personal to me, and that's illegal immigration. Now look, my parents, they came to this country the right way.